Magandang araw po muli, mga classmate. Pagpapatuloy po natin ang ating pag-aaral tungkol sa dugo or sweat, blood, number 19 na po tayo. Sublingual veins. So, titingnan pa rin po natin yung sublingual veins. Observation of the tongue should always include observation of the veins under the tongue. So, napakahalaga po lagi nating titingnan, hindi lang yung body, hindi lang yung side, kundi yung likod ng tongue, yung sa likod. Under normal circumstances, the veins are not distended, not dark, and one can barely see their outline. Although a purple color of the veins under the tongue is clinically very significant. Madali po natin siyang makita pag pinabaliktad natin yung dila. Other abnormalities may also be observed, such as, for example, the veins being distended and shiny. When the veins under the tongue are purple, it indicates the early stages of blood stasis. So yun, pag nakita na po natin yun na may purple na dun sa veins. The sublingual veins, therefore, become purple before the rest of the tongue. A purple color of the veins under the tongue gives an early indication of blood stasis, particularly in the upper and middle burners. So, pag nakita po natin yon, hindi pa lang yung buong tongue niya magpa-purple, nagsasabi na yun na may stasis. Kaya dapat tayong mga acupuncturista, makita na natin agad yun at maipaliwanag. So in modern China, doctors also correlate the appearance of the sublingual veins with modern diseases such as hypertension and arteriosclerosis. Kasi pag meron pong sublingual veins na ganyan, yun, rule out na talaga natin, related yun dun sa kanilang, yung minsan mataas talagang presyon. So pag distended po yan ay Qi deficiency. So distended and dark, yan po yung may blood stasis. Nakita natin yun, So, early indication of blood stasis in upper burner. So, yung mga organs po sa upper burner, yun yung lungs and heart, but also in the liver. Pagtutin, yung deficiency po yun. So, pag swollen naman, white, sticky, dampness and stasis of blood. So, B syndrome po yan. Pag reddish and shiny, may dampit po siya. Pag yellowish po, turbid dampness, steaming upward. White slippery, meron siyang cold dampness. Pag dark, dry veins, severe yin deficiency with empty heat. Kaya tingnan po natin yung mga picture. Yan, sublingual veins is lightly dark para may idea tayo ng mga itsura. Sublingual veins, dark and distended. Ayan po yung parang mga namamaga-maga, Sublingual veins, very dark on the left side. Ayan po yung yellowish shiny sublingual veins. So, nagsasabi po yan na may damp heat. Ito naman, very slightly purple sublingual veins. Sa right side po yan. Okay. So, yan. Tingnan po natin yung mga picture para mapamiliarize tayo. Mga blood stasis po yan. Yan yung mga veins sa likod ng dila. Yung sublingual veins in relation to modern diseases. Pag dark purple veins pang nakita natin, ito ay may blood stasis. Sa heart po yan. And or lungs. Yan. In some cases, it indicates hardening of the arteries in the brain. So, sign po yun na tumitigas na yung ugat. So, yan na yung mga prone sa na stroke. Distended dark and crooked veins. So, meron pong hardening sa arteries, high blood pressure. If veins also stick out a lot and look like earthworm, ibig sabihin po nun, severe yung disease. Nakita natin yung parang nagsizigzag na yung veins dun sa likod ng dila. Pag may dark nodules sa veins naman po, yung mga small nodules like rice or wet grains, yung parang mabukol-bukol sa ilalim ng dila. So, indicates po ito na may hardening ng arteries. Pwede po ito yung heart disease. So, napakahalaga po nun. Ating matandaan yung mga sign na yon. Kasi kahit hindi pa yan tiningnan sa doktor, bago lumala, mapiprevent na po natin. po, salamat po. Naway may nakuha tayo at natutunan.
Maraming salamat po, Ma'am Mildred. I'm sure marami pong natutunan yung ating mga attendees. Thank you. Next, we go to tongue diagnosis. Still about tongue. Let's welcome Ma'am Teresita Sumile.
Good afternoon po, Dr. Hector and classmates. Welcome to tongue diagnosis, and now let's talk about red tongues with kidney deficiency. Continuation po ito kahapon. We have a patient, male, 32 years old. Tongue description, I read deep red, especially in the center, as we can see in the tongue picture. Then wide shape, deep red tip, and whitish slippery coating at the sides. Dirty yellow coating at the center. Okay. Now symptoms are severe heartburn, stomach pains, insomnia, nightmares, inner restlessness, panic attacks, and excessive sexual drive. Western diagnosis, none. Background, the disease, excessive use of alcohol, coffee, and nicotine. Excessive masturbation. PCM diagnosis, kidney deficiency with stomach fire, internal heat and toxin due to alcohol, heart fire, and long-standing accumulation of phlegm or phlegm fire. Case history. Mr. S, a 33-year-old social worker, complained about severe heartburn and stomach pains. The pain became worse whenever he consumed alcohol, when he did in large quantities on a regular basis. He also drank large amounts of coffee and smoked more than 30 cigarettes daily. Extreme inner restlessness, insomnia, and an excessive sexual drive led to a very unsteady lifestyle. He was exhausted, but at the same time, extremely excitable and active. His tongue was deep red. His remarkable pulse was flooding, rapid, and excessive. During the consultation, the patient revealed that he masturbated at least twice a day. Because of the frequent loss of sperm, the essence and kidney were damaged. The wide, deep red tongue body and the flooding, rapid, and strong pulse were the result of excessive heat. These heats injured the kidney, which in turn was unable to nourish the stomach yin. The heartburn and stomach pains were caused by the deficient stomach yin as well as fire in the stomach, which resulted from a diet of predominantly fried, fatty foods, alcohol, and coffee. The tip of the tongue was of a deep red color. In this case, that pointed to heart fire. The weakened yin, together with heart fire, failed to anchor the spirit, leading to insomnia and inner restlessness. So, a red tongue always denotes the presence of heat. Depending on its strength, the heat will eventually injure the yin. If kidney yin deficiency is present, the red tongue will be accompanied by a coating that is either without root or peeled. In this situation, it is very important that the yin be tonified with excessive heat, especially at the onset of an illness. A yellow thick coating will often be visible. When the illness is caused by heat, there will always be a tongue coating. In treating such a patient, it is important to first eliminate the heat before proceeding to tonify the yin. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We now proceed to diagnosis by interrogation, and let's call on Ma'am Vina Pasqua of Baguio. Good afternoon, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. Sexual symptoms po, day 3 po tayo at impotence 2. So, continuation po ito kahapon. Pag full, yung damp heat in the lower burner, impotence, burning on urination, sperm in urine, difficult urination, sticky yellow, tongue coating, slippery, rapid po ang pulso. Ang ginamit po na points dito ay liver 2, REN 12, REN 9, spleen 9, LI 11, REN 3, REN 5, bladder 22 po. In young men, however, it is, sabi po ng author, it is my experience that impotence is often related to a heart pattern and anxiety. In few cases, impotence also may be caused by damp heat in the liver channel. So take note po, impotence in young men is caused frequently by a heart pattern rather than a kidney deficiency. Ang treatment po dito, erectile dysfunction from kidney deficiency. Ang ginagamit po na points dito ay bladder 23, REN 4, kidney 13, at saka kidney 3 po. So, clinical note, sabi na naman ng author, in my experience in young men, impotence is due more often to a heart disharmony than to a deficiency of kidney young. In treatment with acupuncture, ang ginagamit daw niya na points ay heart 7, do 24, REN 15, and with REN 4. Sa pag-treat naman ng herbal medicine, wag daw kalimutan na idagdag 1 or 2 herbs to invigorate blood, especially danshin. Yan sa herbal po. So, ito yung summary, impotence. Kidney yang deficiency, nakakaramdam ng patient ng impotence, feeling cold, backache, abundant clear urine. Pag heart blood deficiency naman, impotence, dizziness, palpitations, choppy pulse. Pag heart fire, impotence, palpitation, insomnia, dream disturbed sleep, rapid overflowing pulse. Pag damp heat in the liver channel, impotence, heaviness of the scrotum, urethral discharge, sticky yellow coating. So yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Next, pulse diagnosis. Let's welcome once again, Ma'am Mildred Tigma.
Magandang
Ma'am Mildred.
Magandang araw po muli. Papatuloy po natin ang ating pag-aaral sa pulse diagnosis, other pulse qualities. Steering pulse. So this pulse also called a moving or shaking pulse. The steering pulse will be seen when a person is in shock or acute pain. So yung may mga nasa-shock po, ito yung makikita natin na pulse nila. So it is as if the pulse does not travel in a wave but remains in the individual position and vibrate. Nasa isang lugar lang po yan, nararamdaman natin na nagbabibrate. So the pulse is described as being like a bean that spins around its own axis. The pulse is fast, smooth, and strong. Pain results in the pulse contracting and becoming wiry. Shock causes chi to become chaotic. Chi and blood separate from each other and chi races ahead without blood being able to follow. So parang naghiwalay po yung chi at saka yung blood. Kaya steering pulse po yung mararamdaman. Steering pulse, pattern of imbalance, yung mga tao pong mayroong shock or may acute pain. Pag slow pulse naman po, as described earlier, what is defined as slow pulse will be different from person to person. A rule of thumb is that a pulse that is slower than 64 beats per minute is a slow pulse. The slow pulse arises when there is cold. So, pag malamig, bumabagal yung pintig. So, 64 beats, mas mababa sa 64 beats po yun, ano? So, yung deficient cold po can be seen when there is yang deficiency. So, mas mataas yung lamig. A deficient cold po yun. In which case, the pulse will be weak and slow. So, yung excess cold po, ay binablock niya yung yang and inhibits blood in its movement by contracting the vessels together. So, when there is excess cold, the pulse will feel tight or confined. So, yung lalim po ng pulse, magsasabi na kung saan po nakalagay yung lamig sa ating katawan. So, yung slow pulse po, pattern of imbalance, basta slow, ito po ay cold. Yung typical combination po, slow and weak, yang deficiency. Slow and full, tight or confined, excess cold po yun, fully. Yan. Slow and superficial, ito po ay invasion of exogenous cold. Slow and deep, internal cold na po yun kasi nasa deep level. Slow and slippery, slim or pag rapid pulse naman po, the pulse is usually a pulse where there are more than 80 beats per minute. So, pag mas mataas po yung 80 beats per minute is rapid pulse. More than 80 beats. What defines a rapid pulse will depend on the person's age. So, yung rapid pulse po always sign of heat. Heat agitates the heart, accelerating its circulation of the blood. Yung strength ng pulse po will determine if it is yin deficiency, heat, or excess heat. The depth of pulse will determine in which aspect of the body of heat is located. So, even though a fast pulse always indicates the presence of heat, basta fast po, heat yan. The opposite is not always the case. Yung several situation po in which the pulse is not rapid, even though there is heat, in some of the situation, the lack of speed in the pulse has diagnostic relevance. In other, it does not. Some of the reason that the pulse is not rapid despite the presence of heat are. Yun. Kahit po may heat pero hindi po rapid yung pulse, pag ang person daw po ay plays a lot of sport or very physically active. Yan. A person take medication. Pwede pong hindi fast yung pulse niya. Siyempre yung old age. Pag meron po siyang damp heat, pag meron siyang phlegm, yung heat is chronic and has weakened chi. Pag meron siyang mixed pattern where there is a both heat and cold. Concurrent kidney yin deficiency and kidney yang deficiency. True cold or false heat. So there are also situations where the pulse is rapid, even though the person does not have a heat imbalance. Yun. Mabilis yung kanyang pulso. There will usually be due to the temporarily presence of heat in the body. Halimbawa po, yung tao ay yung runs up the stair, tumakbo sa hagdanan, will have generated warm in the body. The person's face will be red. They will sweat. And their pulse will be faster than normal. So, there are all heat sign. Kasi nga, syempre, tumakbo siya eh. Indicating that a person has heat in the body right now. So, this is how, however, a temporary condition with no diagnostic relevance. Kasi, pag nagpahinga siya, babalik sa normal yung kanyang pulse. Hindi na bibilis. Other conditions that can cause the pulse to temporarily accelerate are, pag may mental stress po, tumataas yung ating pulse, bumibilis. Pag nagagalit ka, yan. Pag may shock, pag overexertion in a patient who is sick, and blood deficiency. Siyempre, pag deficient po tapos biglang mag-exercise ka ng sobra, bigla pong bumibilis din yung iyong pulse. Pag meron kang nervousness, siyempre pag natatakot ka, bumibilis din po yung pulso. So, pattern of imbalances po pag may rapid pulse, ito ay sign of heat. Typical combination po, rapid and without strength, yin deficient heat. Rapid and forceful, excessive po yan. Rapid and superficial, so invasion of exogenous heat. Rapid and deep, internal heat po yun. Rapid and slippery, phlegm heat or damp heat. Thank you po. Naway may maalala tayo sa mga iba't ibang sign ng pulse.
Thank you very much, Ma'am Mildred. Let's now proceed to differential diagnosis. Let's call on Ma'am Needs U for small intestine chi tide. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector. Good afternoon, everyone. How's my audio, Doc? Medyo umuulan. Hello.
Okay naman, very clear.
Sana wag mawala. Okay. Welcome to our TCM Foundations number 201, Small Intestine Chi Tide. Parang itinali na Chi. Okay po. So, ang etiology or causes, excessive consumption of cold and raw foods, hindering the transformation function of the small intestine. Underlying and or accompanying pathology, stagnation of liver chi invading the spleen chi deficiency. Okay. Signs and symptoms, intense abdominal pain, intolerance of pressure on the abdomen, abdominal distension, constipation, vomiting, or borygmi, flatulence. Okay. Pulse when you palpate is thick, white po. Balik to Deep and wiry, magpaliktad. Ang pulse ay, ang tongue ay thick, white coating. Okay. Treatment principle, course of small intestine and rectify chi, harmonize the stomach. Okay. Acupuncture intestine chi, stops the pain. Brain 6, moves chi in the lower burner. Spleen 6, stops abdominal pain. Stomach 25, stops abdominal pain, harmonizes the stomach. Extra point, low ratio, if appendicitis is suspected. GB34, moves stagnation, relieves pain. Liver 3, stops pain and spasms. Needle with drainage. Thank you very much. I hope you learn. Thank you po, Doc.
Thank you very much, Ma'am Needs.
Hello.
Thank you very much, po. Thank you. Okay. After differential diagnosis, we proceed to acupuncture patterns and practice. Let's listen to Ma'am Teresita Sumile once again. She will continue her discussion of edema. Good afternoon, Ma'am Teresita.
Good afternoon po ulit, Dr. Hector. Welcome to Acupuncture Patterns Practice, and let's continue our topic on edema. Kahapon, we talked about yang edema. Ngayon naman ang yin, edema. So, spleen-yang deficiency may result from overindulgence in proper diets or excessive physical fatigue. In either case, the spleen and the stomach are injured and the ability to transport and transform water is impaired. The retained water has nowhere to go but to overflow into the superficies, giving rise to edema. Kidney yang deficiency governs water metabolism and is in charge of the discharge and retention of fluid. Overindulgence in sexual activity, multiple pregnancies, and protracted illness improperly or inadequately treated can all consume kidney qi. Failure of the kidney in qi transformation and water circulation results in water retention. Hence, the water overflowing into the superficies and giving rise to edema. Now let's go to clinical manifestations. When edema first develops, it tends to affect the eyelids. From the eyelids, it spreads to the rest of the face and to the distal extremities. It then progresses to the trunk. Sometimes, edema can begin in the feet and progress up to the legs and eventually the entire body. Okay? Now, in mild cases, edema may be limited to the eyelids, the face, and the distal lower extremities. In severe cases, the entire body may be affected. The abdomen may be markedly distended, and the chest may become tight with palpitation of the heart and orthopnea. In even more severe cases, there may be anuria, nausea, vomiting, pitted halitosis, epistaxis, and gingival bleeding. There may even be critical symptoms such as headache, convulsion, delirium, or coma. Key points of analysis. Yang edema versus yin edema. Yang edema develops mainly when exogenous pathogenic evil invades the body and causes visceral organ dysfunction. Yang edema generally begins high in the body and progresses downward to affect the entire body. The skin overlying yang edema tends to be stretched and lustrous, and the edema is non-heating. The skin depressed by pressing rebounds promptly upon release of pressure. So there may be such accompanying symptoms of heat or strength, such as restlessness, fever, thirst, scanty dark urine, or constipation. Yin edema develops mainly when proper diet, excessive fatigue, sexual overindulgence, or protracted illness endures genuine qi, causing spleen and kidney dysfunction. Yin edema tends to develop insidiously and has a prolonged and fluctuating course. It generally begins low in the body and progresses upward to affect the entire body. The skin overlying yin edema tends to be loose, and the edema is heating. Pressure leaves a depression which persists for minutes. There may be accompanying symptoms of cold or deficiencies such as oliguria, loose feces, lassitude, and weakness without thirst. Lingering yang edema can turn into yin edema if genuine qi is depleted or water retention is severe. Yin edema can manifest some features of yang edema if there is superimposed invasion by exogenous pathogen or a sudden increase in swelling. Thus, yang edema and yin edema may be intermingled. Regional correlation. The location of edema and the associated symptoms are useful for identifying the main visceral organ that is diseased. If edema is in the eyelids and face and there are chills and fever, cough and panting respiration, the disease is in the lung. If edema is the face and limbs and there is palpitation of the heart, the disease is in the heart. Okay. Now, if edema affects the entire body and there are heaviness in the limbs, fullness in the abdomen, and anorexia, the disease is in the spleen. If edema is mainly below the waist and there are aching weakness in the waist and knees and cold limbs, the disease is in the kidney. If edema affects the entire body with subcostal and abdominal distension so that it is difficult to move or turn over, the disease is closely related to a pathological condition of the liver. Acupuncture treatment. Yang edema. Select acupoints bladder 13, lung 7, CV9, bladder 22, and spleen 9. Use filiform needles and apply the reducing method. Next is yin edema. Select the acupoints bladder 20, bladder 23, CV9, and spleen 6. Use filiform needles and apply the reinforcing method. Forming needle suction may also be applied. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We now,
Pasensya na po sa ingay.
ay okay lang po. We now go to signs and symptoms, and let's welcome back Ma'am Pina Pasqua of Baguio. Good afternoon, Ma'am Pina.
Good afternoon po ulit, Doctor. Good afternoon po sa lahat. So signs and symptoms po tayo, day 93, streaming eyes. Ito yung parang maluha-luha. Streaming eyes may be due to heat of the full or empty type. In particular, maaring it is due to full or empty heat of the lung or stomach. Other causes of streaming eyes include external wind heat, liver fire, and liver blood deficiency associated with liver heat. In some cases naman, streaming eyes may be due to liver blood deficiency and general Qi deficiency o kaya kidney yang deficiency. Itong dalawang type na ito of streaming eyes, ang tawag dito ay cold streaming. So dito, streaming eyes, pag may lung heat, umuubo po yung patient. Pag lung empty heat naman, dry cough. Pag stomach heat, epigastric pain, and thirst ang nararamdaman. Pag stomach empty heat, epigastric pain, thirst with desire to sip. External wind heat, aversion to cold, o kaya ay meron siyang fever. Pag liver fire naman, pula po yung mga mata at ang panlasa ay magtakip. Liver blood deficiency with some heat, blurred po ang vision, red eyes. Pag liver blood deficiency, blurred vision. Pag kidney yang deficiency naman, sumasakit ang likod at abundant clear ang urine niya. So, ang general Qi deficiency, tiredness, loose stools, at saka mahina po ang boses. Meron pong traditionally two types of streaming eyes. One is called, ang tawag nila ay, hindi ko alam, pakicheck Dr. Liu Li, which indicates runny and streaming eyes. Described here, the other is called Yanqi, which indicates a thick, yung makapal po yung discharge from the eye, and it is described under discharge from the eyes. Pag liver blood deficiency naman, streaming eyes, may flutters, blurred vision, dizziness, numbness or tingling of limbs, scanty menstruation, dull pale complexion, pale tangko, at ang pulso ay choppy or fine. Ang tawag naman dito ay cold streaming. Then, ang last po ay kidney yang deficiency, streaming eyes, lower back ache, cold knees, feeling cold, bright white complexion, mahina po yung mga tuhod at nakakaramdam ng pagod, abundant clear urination at sa kapag gabi urination at night. Pale at saka wet po yung kanyang dila. At ang pulso naman ay deep weak. Ang tawag po dito ay cold streaming. So, yan lang po. Thank you, Doctor. Thank you sa lahat ulit.
Maraming salamat po, Ma'am Vina. Let's go now to bleeding. We will continue discussing the pathology of bleeding. Qi deficiency. One of the functions of Qi is to control blood, holding it in the vessels. If Qi is deficient, it may fail to hold blood in the vessels and lead to bleeding. This is a deficient type of bleeding and is due primarily to spleen Qi deficiency. Kidney Qi also holds blood in the vessels. its deficiency and sinking is implicated in bleeding from the uterus or bladder. When Qi deficiency causes bleeding downward from the uterus, bladder, intestines, there is also an element of Qi sinking. This does not mean that Qi deficiency always leads to bleeding. Bleeding from Qi deficiency is often, but not exclusively, characterized by a downward movement. So it is a form of sinking of spleen Qi and or kidney Qi. Thus, it often causes bleeding from the lower orifices. Typical examples: excessive menstrual bleeding or bleeding in the stools or urine from deficient spleen Qi not holding blood. Bleeding from Qi deficiency is a passive process. Blood leaks out of the vessels as the Qi is unable to hold it in. Bleeding from Qi deficiency is characterized by fresh appearance and bright red color of the blood and is accompanied by symptoms and signs of Qi deficiency. Now let's talk about blood heat. Heat causes bleeding by invading the blood portion and damaging the blood connecting channels. Heat makes the blood restless and causes it to extravasate. In contrast to bleeding from Qi deficiency, bleeding from blood heat is an active process. The blood is agitated by heat, becomes restless, and spills out of the blood vessels. Bleeding from heat may be upward or downward. For example, excessive menstrual bleeding and bleeding in the stools or bladder may also be caused by heat in the blood. Bleeding upward is typical of blood heat and is always characterized by rebellious Qi. Kaya yung mga nosebleed na yan, rebellious Qi yan, no? Example is bleeding from the nose and vomiting or coughing of blood. This type of bleeding is associated with Qi rebelling upward, carrying fire with it, and injuring the blood connecting channels upward. With herbal medicine, we can use Chuanyu Shi Radix Sayatule to attract blood downward. In bleeding from heat, the blood may be bright red or dark red, and the flow is usually profuse. Blood empty heat. Empty heat from yin deficiency leads to bleeding in two ways. Yin Qi is a type of Qi, and just as deficient Qi fails to hold blood, so deficient yin may also fail to hold blood. Empty heat deriving from yin deficiency may invade the blood portion, just as full heat does, making blood restless so that it pushes out of the blood vessels. Bleeding from empty heat is usually scanty, as there is yin deficiency and blood is part of yin. Color of blood is fresh red or scarlet red. It may occur in coughing from the nose, under the skin, in the form of petechiae, in the stools, from the uterus, or in the urine. Thank you very much for listening. We would like to thank everyone for joining. If you have questions, please write them on the chat box. And we'd like to thank the presenters for their time, and we invite everyone to join us again next week. Good afternoon, everyone.
Good afternoon, Doc. Thank you so much.
Thank you, Paul. Thank you very much.